So let's talk about the NSAIDs. Okay, and we are including that in the category of non-opioids. Okay, non-opioids or non-narcotic analgesics. Okay, fine. So if I am talking about the NSAIDs, non-steroidal anti-inflammatory drugs, we are having one pathway. So first of all, what are the actions of these non-steroidal anti-inflammatory drugs? First of all, we are using that as analgesics. We are using that as anti-inflammatory. And we are using that as antipyretic. Okay, so three kind of effects simultaneously we can get with the help of NSAIDs. Okay, and these kind of drugs we are using quite often in the home, right? So in every home you can find the NSAID. For example, ibuprofen, indomethacin, diclofenac, right? These kind of drugs you can find easily. So paracetamol is the quite common. Yeah. So if we talk about the NSAID, let's talk about the mechanism of action. Then we'll be talking about the classification. Okay. So what is the mechanism of action of the NSAIDs? So there is one pathway. Already we have discussed about that many times earlier. So in the cell membrane is made up of phospholipids. Yeah. So phospholipids, they will be converted actually into what? Arachidonic acid. They're converting into arachidonic acid with the help of an enzyme. Now what is that enzyme? Phospholipase A2. PLA2 in short. Phospholipase A2. It is converting into arachidonic acid, phospholipids, right? Now arachidonic acid can be converted into what? They can be converted into prostaglandins, and they can be converted into leukotrienes. Okay, which enzymes we are using over here? We are using the COX over here, cyclooxygenase enzyme. Okay, and we are using the LOX over here, that is the 5-lipooxygenase enzyme. Okay.
What's the difference between COX and LOX?
COX and LOX, the difference is if we are talking about this pathway, we are talking about the allergies. We are talking about the histamines. We are talking about the vasodilation things. We have already talked about the drugs which are working over here. Okay, for example, omalizumab, I told you. Yeah. So these kind of drugs, so that is a different thing. That thing, if you are talking about, you are talking about the histamine, you are talking about the allergies and all these things. We are having some kind of drug that, for example, anti-leukotrienes, okay, which will be inhibiting the allergies and all. If you are talking about this pathway, it is related to the inflammation. Okay, so this pathway is related to allergies. This pathway is related to inflammation. Okay, so we are talking about the anti-inflammatory. What is the name? Non-steroidal anti-inflammatory drug. So we are talking about which pathway? We are talking about COX. Okay, so COX are having the two COX are present, COX1, COX2. COX3 is also present in the brain, but we are not talking about that usually. Okay, actually paracetamol is working on the COX3. Okay, but usually we don't talk about that. Fine, so COX enzymes are there. Okay, so because we are having COX1 and COX2, some of the drugs which we have discovered, some of them they are working on COX1. Some of them they are working on COX1 and COX2 simultaneously. Most of the drugs actually they are working on COX1 and COX2, and some of the drugs we have discovered they are working only on COX2. Okay, so on the basis of that we are having the category as non-selective COX inhibitors, which is inhibiting the COX1 as well as COX2, and we are having the selective COX2 inhibitor, which is only and only inhibiting the COX2 enzyme over there. Okay. So we are going to talk about this one, inhibiting this one. So our NSAIDs or non-opioids, they will be inhibiting the COX enzyme. So if the COX enzyme will be inhibiting, prostaglandins will not be able to form over there. Okay, fine. So about this one, that was the mechanism of action. So they are inhibiting the COX enzyme, so prostaglandin will not be able to form. What are there, for what purpose we are talking about the prostaglandins? Prostaglandins are, yeah, they are giving you the pain sensations. More and more prostaglandins, which means more and more pain. Okay, the classical example is in the females who are having the menstruation cycles. Usually they are painful. Why they are painful? Due to the prostaglandins. Okay, so the females who are ovulating, who are having the menstruation every month, they're having the painful menstruation, they're having the painful periods every month. On the other side, there are the females who are having the painless menstruation, which means probably they are anovulatory, and if they're anovulatory, in those cases prostaglandins are absent. If the prostaglandins are absent, they will be having the painless menstruation. Okay, so that was the example which you can relate with. So prostaglandins are responsible for the pain. Fine, so that is about the pain. So if there is no prostaglandins, there is no pain. Fine. Okay, now let's talk about the classification. Okay, so we are having two classes over here. That is the one is the non-selective, and one is selective. Rather, I should say selective COX-2 inhibitor. Okay, if you need to choose between non-selective and selective, what you will be choosing? Choose not selective, choose non-selective. This is the first line drug. Selective COX-2 inhibitor looks like it is having the good effect. It will be only and only working on COX-2, and you will be having the good one. Everything is fine. That is also the true statement, but the thing is about the side effect. They are having more chances of causing myocardial infarction, and there are more chances of causing stroke. Okay, more chances of stroke, more chances of MI. However, it is having the less chances of causing the gastrointestinal tract toxicity. Okay, but due to this one, this is not the first line drug. Okay, due to the effect of MI and stroke, these are the emergency situations, right? These are the dangerous one, MI and the stroke in the brain. Okay, because they are having more chances of producing the thrombosis inside the blood vessels, so it can lead to the blockage of coronary artery, it can lead to the blockage of the cerebral arteries. Okay, so it can lead to stroke and MI. So that's why selective COX-2 inhibitors are the second line drug, not the first one. So these are the first line drug. Okay, non-selective are the first line drug. So in the non-selective, what we are talking about, first of all we are talking about the aspirin. Aspirin is also called as acetyl salicylic acid. Okay, then we are having the drug which is PCM. PCM is what? Paracetamol. Okay, paracetamol is also called as acetylcysteine. What? Yeah, it is in the, yeah, it is working on this one, COX-3. Yeah, this is working over there. Okay, sorry, acetylcysteine is the antidote. This is the acetaminophen. Acetaminophen. Okay, N-acetylcysteine is the antidote. N-acetylcysteine, this is antidote. Okay, fine. Then we are having diclofenac sodium. Okay, mainly they are present in the tablet form, mainly they are present in the cream jelly like form. Okay, and some kind of gels for the back pain relief. Okay, lower back pain relief and all these things. They are having the combination of diclofenac. Okay, diclofenac, indomethacin, mefenamic acid. They are having the combination of all these things. So they are usually more commonly in the household. We are using that topically in the jelly form, right? Then we are having in the tablets also we can take here. diclofenac, okay, mefenamic acid, then we can include indomethacin, okay, we can also include piroxicam. So these are some of the drugs which we can include in the category of non-selective COX inhibitor. Mainly they are inhibiting the COX-1 as well as COX-2. Okay, so aspirin, PCM, paracetamol, diclofenac sodium, mefenamic acid, indomethacin and piroxicam. Okay, mainly aspirin, okay, is important in this classification, because aspirin is the most non-selective. They are working on COX-1 as well as they are working on COX-2. Okay, however other drugs are also behaving like that, but this is the most strong non-selective. Okay, now what are the side effects of using these kind of drugs? Okay, before the side effect, let's talk about the COX-2 category also. In the COX-2 we are having, they're ending with coxib. For an example, celecoxib, etoricoxib or parecoxib. Okay, so they are ending with what? Coxib. Okay, they're ending with coxib. Okay, and mainly you should remember celecoxib because that is important, COX-2 inhibitor. Okay, what are the side effects of using these coxibs? Why they are second line drugs? Because increased chances of myocardial infarction and the stroke as well. Okay, fine. So what can be the side effects? If we will be able to know the location of the COX enzymes, it is quite easy for us to understand the side effects of these drugs. Okay, so COX-1 enzyme is actually present in the stomach lining, in the GIT lining. Okay, and they are maintaining the mucosal lining of the stomach. Okay, so if this is the stomach, okay, if this is the stomach over here, this is duodenum. So in the stomach, you know, inside it we are having the lining. This is the lining of the stomach. This is the mucosal lining. Okay, this is the mucosal lining over here, and this mucosal lining is made up of which enzyme? That is the COX-1 enzyme. That is what enzyme? COX-1 enzyme. Okay, and if you are using the COX inhibitor, for example, you are using aspirin. Okay, aspirin you are using, and aspirin is working on COX-1 as well as COX-2. If you are inhibiting the COX-1, which means you are inhibiting this enzyme, you are inhibiting the mucosal lining. Okay, and if the mucosal lining will be inhibited, which means mucosal lining will not be able to protect the lining of the stomach from the acid inside it. What is the pH inside it? 2 to 3. That is quite acidic. Okay, so stomach, you know, this acid will be having the chance to irritate the lining of the stomach. Okay, stomach. And what can lead to this kind of situation? It is leading to increasing chances of peptic ulcer disease. Yes, it is leading the chances of peptic ulcer disease. So most of the patients who are using the non-selective drugs, mainly the aspirin, they are having the problems of what? They are having the problems of rectal bleeding. They are having the problems of the peptic ulcer disease. They are having the problems in the gastroesophageal reflux disease. They are having the problem with the indigestion. Why these kind of problems are coming? Because of destroying of the mucosal lining. Okay, and that's why aspirin we are not prescribing the patient for a longer period of time. Okay, because of this side effect. Fine. Okay, so that was about the stomach. You know, inside the kidneys also we are having the COX-1 enzyme. Inside the kidneys also we are having the COX-1 enzyme. So if the COX enzyme is there, you know, it can lead to what? Renal failure cases. Okay, so if you are inhibiting the COX-1 enzyme in the kidneys also, okay, what will be happening? Then it can lead to renal failure cases. However, it is related to the long period of use. If the patient is taking, let's say the patient is taking the COX inhibitor for 6 months, this kind of patients are more susceptible for having the liver failure, kidney failure, right, and all these kind of things. Fine. Okay, so that is about the side effect of this one. Aspirin is having one more side effect. If I'm talking about the aspirin, they should not be using in gout. Okay, we should not be using the drugs in gout, because in the gout, what is the problem? There is a problem in the development of uric acid, right? Uric acid accumulation which is happening in the joints. Okay, so in the gout, which joint mainly we are talking about? Most knee joints. Okay, but yeah, knee joints, that is the right answer. But if the question comes, most common joint involving in the gout is,
The toe.
yeah, that is in the toe region, that is the first metatarsophalangeal joint. Okay, you know, these are the carpals, they are the metacarpals, they are the phalanges. Now imagine if this is a toe, these will be the tarsals. Carpals are 8, tarsals are 7. They are the tarsals, metatarsals, and then phalanges. So first one, that is the thumb. So metatarsophalangeal joint, if this is a toe, then here. Okay, so they will be having the shape of this kind of thing. Okay, shape of this kind of thing, which means this is the uric acid that is accumulating over here. This is the first metatarsophalangeal joint, first MTP joint. Okay, fine. So that is the gout situation. Aspirin should be not using over there, because it is decreasing the uric acid excretion. It is decreasing what? Uric acid excretion. Due to that effect, we are not using the aspirin in gout. Okay, aspirin are very helpful in rheumatoid arthritis. Okay, in the rheumatoid arthritis, usually we can use the aspirin for diagnosing the rheumatoid arthritis, because aspirin, the patients who are having the rheumatic disease, the patient who are having the rheumatoid arthritis, you give the high doses of aspirin. If the patient is responding wonderfully, that means this patient is having rheumatoid arthritis. Okay, so some of the doctors are using that for the diagnostic purpose also. Okay, so if the patient is responding to the aspirin quite wonderfully, that means that patient might be having what? Rheumatoid arthritis.
Sorry, one second.
Look, if the patient is having rheumatoid arthritis, okay, you will be giving what dose? Aspirin dose, high dose of aspirin. If you're giving high dose of aspirin, if the patient is responding wonderfully, that means the patient is having what? Rheumatoid arthritis, because aspirin is working very good in cases of rheumatoid arthritis. Okay, fine. About the paracetamol, they are not having the effect of, we are talking about the actions of NSAIDs, analgesic, anti-inflammatory, antipyretic. PCM is not having the effect of anti-inflammatory. Okay, so PCM is having the effect of antipyretic, PCM is having the effect of analgesics, but PCM is not having the effect of anti-inflammatory, which means the PCM is not related to decrease the inflammation in the patients. Okay, PCM will be taking care of the pain. PCM will be taking care of fever also, but they will be not be working on the inflammation. Okay, that is not anti-inflammatory drug. Fine. Okay, that is about the PCM. PCM is quite safe also in children's. Okay. Fine. About the COX-2 location, COX-2 is present in, one more thing. Aspirin is also used as antiplatelet drug. Again, in the monotherapy, A was aspirin in the MI, right? Why we are using aspirin over there? Because of its anti-aggregating effect or anti-platelet effect. Okay, so COX-1 is also present in the endothelium of the blood vessels. COX-1 is also present in the endothelium of the blood vessels. So about the aspirin, I told you about these three effects, right? If you are giving the low doses, aspirin will be working as antiplatelet. Okay, if you are giving the intermediate doses, aspirin will be working as antipyretic. Okay, and if you are giving high doses of aspirin, then it will be working as anti-inflammatory. Okay, so we are using actually the low doses of aspirin in cases of myocardial infarction to get the effect of anti-aggregation or antiplatelet. Okay, fine. COX-2 location is at the site of inflammation. Whenever there is a inflammation, there is a COX-2 enzyme. So if we are talking about a celecoxib like drug, they will be working over there. They will be working only and only on COX-2, and they will be relieving the inflammation over there. Because they are not working on COX-1, they are not having the side effects such as peptic ulcer, okay, or such as more chances of bleeding. If you are using aspirin in low doses for a longer period of time, it might lead to bleeding. Why? Because COX-1 is present in the endothelium, it is having the antiplatelet effect, so it might lead to bleeding in the patient. Okay, so comparatively COX-1 is having the more side effect, COX-2 is having the less side effect, but they are having the severe side effects. Okay, because it can lead to what? Increased casing of MI and stroke in the patients. Okay, so that was about the non-steroidal anti-inflammatory drugs. So what was, so once again, yeah.
COX-2 location.
COX-2 location is the site of inflammation. At the inflammatory site, there is a releasing of the COX-2 enzyme, and celecoxib, parecoxib, these kind of drugs can act over there. Okay, fine. So about the NSAIDs, they are the non-steroidal anti-inflammatory drugs, non-opioids, and they are having the three effects: anti-inflammatory effect, antipyretic effect, and analgesic effect. Mechanism of action is they are working on COX enzymes. Okay, there was one phospholipase A2 enzymes also, and which drug is working over here? They are inhibiting over here. These are the steroids. Okay, so steroids can also be given in the inflammation. Okay, so steroids are more powerful anti-inflammatory as compared to NSAIDs. So steroids are more powerful as compared to NSAIDs. Okay, because directly they are blocking the arachidonic acid. So arachidonic acid further will not be able to convert into prostaglandins. Okay, fine. So our NSAID was working on what? COX enzyme. We are having COX-1 and COX-2. COX-1 location is the endothelium of the blood vessels inside the kidneys and inside the mucosal lining of the stomach. Okay, COX-2 enzyme location is inflammation site, right? So we are having the non-selective and selective COX enzyme inhibitors. So non-selective is the first line drugs: aspirin, PCM, diclofenac, mefenamic acid, paroxysm, indomethacin. Aspirin is having, this is the most strongest non-selective anti-inflammatory drug. If you talk about the NSAIDs, they are having the side effects such as bleeding from the stomach, all the GIT symptoms. Renal failure might happen in the patient for the prolonged usage, and it is very helpful in the conditions of rheumatoid arthritis. It should not be given in gout cases because it is decreasing the uric acid excretion. Okay, fine, because if it is decreasing uric acid excretion, uric acid will accumulating over there and it can lead to the worsening of the symptoms of gout. Okay, then we talked about the paracetamol. Paracetamol is quite safer in children. They are not having the effect on the anti-inflammation. They are having the effect on analgesics and antipyretics. Okay, what can be the side effects of COX-2 inhibitor? That is the myocardial infarction and stroke. It is reducing the chances of GI toxicity, which means because COX-1 is not there, it is not inhibiting the COX-1. That's why these kind of cases will be reduced in while there is the uses of COX-2 inhibitor. Okay, so that was about the non-steroidal anti-inflammatory drug.